Tips for conducting a patient medication interview. Number 1. Medication information. To obtain or verify a list of the patient's medications, you should inquire about. When obtaining or verifying a patient's medication list, inquire about prescription medications, all current prescribed drugs with dosages and frequencies. Sample medications, any samples provided by healthcare offices or pharmaceutical representatives. Over-the-counter, OTC, medications, pain relievers, antacids, allergy medications, sleep aids, etc. Vitamins and minerals, multivitamins and individual vitamin or mineral supplements. Herbal supplements, plant-based products such as ginkgo biloba, St. John's wort, turmeric, ginseng, etc. Nutraceuticals and health supplements, probiotics, omega-3s, protein powders, and other dietary supplements. Respiratory therapy medications, inhalers, rescue and maintenance, nebulizer solutions, and oxygen therapy. Essential elements to document for each medication. To ensure accurate medication reconciliation and safe prescribing, capture the following information for every medication. Medication name, both brand and generic names when available. Strength, dosage amount. Formulation specific delivery form such as extended release, immediate release, delayed release. Other formulations: capsule, tablet, liquid, dose, amount taken per administration. Route of administration, how the medication is taken: oral, sublingual, buccal, intravenous, intramuscular, subcutaneous, topical, transdermal, inhaled, nasal, rectal, vaginal, ophthalmic, otic. Frequency, how often the medication is taken: scheduled daily, twice daily, 3 times daily. As needed with maximum frequency. Specific timing: morning, bedtime, with meals, last dose taken, date and time of most recent administration. Number 2. Medication history prompts. Incorporating various types of probing questions into the patient interview may help trigger the patient's memory on what medication they are currently taking. Here are some suggestions. When conducting assessments, use both open-ended questions like, "How has your energy level changed?" and closed-ended questions such as, "Are you able to walk without help?" to gather complete information. Equally important is ensuring you capture all medications, not just oral pills. Many patients forget to mention injectable medications like insulin, biologics, and subcutaneous treatments, as well as topical treatments such as creams, ointments, lotions, and patches. Don't overlook eye drops, ear drops, inhalers, nebulizers, nasal sprays, and suppositories. Ask condition-specific questions like, "What medications do you take for your diabetes?" or "What do you use for your breathing problems?" to help patients remember medications they might not think to mention. Essential questions for medication reconciliation. Number 1. Prescribing providers. Which doctors or healthcare providers prescribe medications for you? This identifies multiple prescribers, specialists, and potential duplicate therapies or interactions. Number 2. Medication timing. When do you take each medication throughout the day? Note patients often forget medications with infrequent dosing such as weekly, monthly, seasonal, or rarely used as needed medications. Ask specifically, do you take any medications weekly, monthly, or only at certain times? Number 3. Recent changes. Has your doctor recently started, stopped, or changed the dose of any medications? Follow up, when was this change made, and why? This captures new prescriptions, discontinued medications, and dose adjustments that may affect treatment. Number 4. Physical medication description. When patients cannot recall medication names, ask them to describe color and shape of the pill or capsule, size, markings, imprints, or numbers on the tablet, packaging or bottle appearance. This physical description can help identify the specific medication, dosage strength, and formulation, particularly when combined with pharmacy databases or pill identification tools. Number 5. Collateral information sources. When medication details remain unclear, contact patient's caregiver or family member. Often manages medications and knows exact details. Community pharmacist can provide complete medication lists with dosage strengths, directions for use, and recent refill history. Previous healthcare facilities may have accurate records from recent visits. These sources provide reliable verification of medication names, strengths, formulations, and administration instructions. Many patients don't consider OTC medications worth mentioning. Use specific symptom-based prompts. What do you take when you get a headache? What do you take for allergies or sinus problems? Do you take anything to help you fall asleep or stay asleep? What do you take when you get a cold or cough? Do you take anything for heartburn, indigestion, or upset stomach? Do you use any pain relievers regularly, like ibuprofen or acetaminophen? Do you take any laxatives or medications for constipation or diarrhea? These targeted questions help uncover commonly forgotten OTC medications that may interact with prescription drugs or affect treatment plans. Effective medication reconciliation requires a systematic approach that goes beyond simply asking, "What medications do you take?" By identifying all prescribing providers, exploring medication timing and schedules, uncovering recent changes, using targeted symptom-based questions for OTC medications, gathering physical descriptions when needed, and consulting collateral sources for verification, healthcare professionals can build a complete and accurate medication profile. This thorough process helps prevent adverse drug events, identifies potential interactions, eliminates therapeutic duplications, and ensures continuity of care. Remember that patients may not consider vitamins, supplements, or over-the-counter products as real medications, so specific, direct questioning is essential to capture the full picture of what patients are actually taking.